Okay, you're a pediatrician in terms of infectious diseases as well as emergency medicine. What's happening to the health of our children in America and abroad?
It's sad. During my career, I started my training in the 90s. And I remember just seeing in the late 90s a really rapid transition to very poor health among kids. Diseases that didn't happen in kids were happening. And now those diseases are not rare, they're commonplace. So we have many states in America where half the children are obese or near obese. We have many states that have massive problems with fatty liver disease in children. We have diseases we just didn't see, like bile stones and kidney stones in children from unhealthy living patterns. We have a very sedentary pediatric population in general. So there are all kinds of reasons for that. Social determinants, I think cultural, I think our health system doesn't prioritize health is one of the main ones. And I've seen this get worse and worse and worse. And so a big part of my passion is we can't just start talking about lifestyle issues when people are 50 in America. And that's what happens. The reality is we go, oh, dang, if you had just taken care of yourself, you wouldn't be having this heart attack at 45 or 50. And so we need to push lifestyle back into the conversation in pediatrics. Pediatrics was theoretically the most preventative specialty in medicine, right? And if you really think about what a pediatrician does, they do way more prevention visits than any other specialist does. But what's happened is we started to not be willing to have those difficult conversations. And I would say not have the time to have those difficult conversations. So pediatricians, my peers that are rank and file day-to-day pediatricians are trying to see 3 to 5 patients an hour. You can't get into those difficult conversations about, hey, your son's BMI is really an unhealthy range, and we need to kind of get some changes in his lifestyle going. That just completely throws a wrench into your day to have that and try and see 3 to 5 patients an hour. And what I'm seeing is doctors are leaving primary care as burnout as any specialty in America, because the reason they went into primary care, they're not allowed to do it. They're not allowed to do preventative care. What's nice is it's really easy now for me to hire people because I tell them, and I have doctors literally crying when I'm interviewing them saying that exists, that I can still do what I went into medicine to do. And I said, yeah, not only can you do it, but I'm going to incentivize you to do it well. I literally won't let you see more than 1.5 patients per hour in my model because you can't do it well, what I'm going to ask you to do if you don't do that. So pediatrics is going to have to step back into these conversations. I have 2 daughters that are in healthcare now. One's a medical student, one's a pediatric resident. And the pediatric resident's at the #1 rated children's hospital in America. And I said, do you have a lifestyle program there? He said, what's lifestyle? And I'm like, oh my God, what is happening? Lifestyle is all the things these kids are doing that are going to kill them when they're 50 to 60 years old. You need to integrate this into your program. So I'm encouraging her in her advocacy track to actually integrate lifestyle medicine into a pediatrics training program. I think every American training program should have you finish with a lifestyle credential program. So that's a huge focus in pediatrics and really adolescent medicine and college students. College students are the least healthy human beings in America. Like, they get away with it, right? They get away with it, but they're binge drinking. They're trying things they shouldn't be trying. They're sleeping none. They're eating pizza. They're not exercising anymore. They leave college with just horrible lifestyle related patterns. And so we need to get into our colleges and say, hey, listen, if you really care about your people, don't just give them an STD clinic, which is what they have. Give them somebody that's having these conversations with them that motivates them to actually learn some healthy living patterns while they're in college. And we're excited. We're actually looking a lot at that space right now of how Medici can become a force for good in college campus health and really change the way colleges think about the health of their people.